My name is John Cernansky. I'm a psychiatrist, and we've made this film to teach you about diagnosis, about how to collect the information in an interview that's needed to make a diagnosis, about how to organize that information to determine whether a person has one diagnosis or another. What you'll be seeing is a series of interviews followed by discussions. The discussions will be conducted by this group of clinicians. Let me introduce them to you. Barbara Steed, a psychiatric nurse. John Newcomer, a psychiatrist. Yvette Shaleen, a psychiatrist. Stephen Malden, a clinical psychologist. And Diane Rising, a clinical social worker. Some of the interviews will involve inpatients in a psychiatric hospital. Some of the interviews will involve outpatients. All of the people who have participated in this have volunteered and understand the nature of this project. You'll also notice that the interviews vary in terms of style. Sometimes that's determined by the person being interviewed, and sometimes just the style of the interviewer. In addition, we're obviously making a film, and we've done nothing to hide that from the person being interviewed or from the interviewer. And you'll notice that the effect of filming is present in each interview in different ways. And now, let's begin with the first interview. Barbara is suffering from an episode of major depression. She also has a long history of changes in mood. Her internal experience is one of loss of purpose and low energy. These symptoms have also disrupted her relationships with her family and friends. One of the most notable symptoms in this interview is her suicidal thoughts. Well, Barbara, I guess we're both a little nervous today. Is this the first time that you've been interviewed while being videotaped?
Yes.
Do you feel okay about that? Is there anything we can do to make the situation more comfortable?
No, it's just kind of nervous. I'm fine.
Okay. This will be an ordinary interview, just like we've had before, although we haven't been videotaped before. How long have you been feeling poorly, and what's that like for you?
I think I figured out that I've been sad, depressed most of my life. I can remember times, I told you, I think before, that I had a headache in high school for a year and a half. And I think that's kind of when it started. And then there have been different periods in my life when I remember being so down I wanted to end it all. And then that kind of went away. I haven't felt suicidal like every day for all 46 years, but there have been periods when it's been particularly bad.
Is this one of those periods?
Yeah, I've been having a really bad time since May. There doesn't seem to be a reason for it.
Okay, how many months total would that be since May?
Since May, I guess that's
about
6
4 or 5 months.
Yeah.
About 4 or 5 months, okay. What was the first thing that you noticed in May that gave you the signal that you were heading down again?
I got mad at my children. I went to bed for 2 days.
So was irritability one of the early symptoms? What did you do when you went to bed for 2 days?
I locked my door and I stayed in there for 2 days, and I came out when they went to bed and were asleep. So I came out and ate like at 4 in the morning and then went back upstairs. Mm-hmm.
What was your mood like during that
I was suicidal. I was a wreck. I was mad at myself because I put myself in that position. I was mad at them because they didn't care enough to come and get me out of my room. Mm-hmm. I didn't know how to end it. Mm-hmm. You know, I mean, I went to my room and I closed the door because I was angry, and then I didn't know how to come out.
I want to understand more exactly what you mean by feeling depressed. What does depression mean to you?
Physically, I'm lethargic to the point of not wanting to get out of bed, mm-hmm. not wanting to shower. if my children aren't home, like they've been in college, I sometimes stay in bed in the past for a couple of days, on and off, if I'm not working, and I can do that. I feel like my arms are so heavy, I cannot lift them.
How do you feel about yourself?
Oh, I hate me. I really hate me. I hate the way I look. I hate the way I feel. I hate the way I talk to other people.
Do you find yourself feeling guilty about things?
All the time. I do everything wrong.
Do you find yourself feeling guilty about things far in the past that are way past doing anything
like
about?
20, 30 years ago, something I said to somebody that hurt their feelings and I didn't mean to do.
Do you have much, when you're feeling that way, do you have much hope for the future? Is there any hope in your view, or is that gone?
The only hope I had, the only thing I was hanging on to all these years was I was waiting for my children to get through college so that I could be done. I felt that that was kind of a goal that I wanted to get to, and that's done. And I don't know where else to go. I have to find something else to do with me, because there just isn't anything to do.
Right. So you feel like
really
you don't have
hopeless.
much of a purpose.
No, nothing.
There's no purpose now.
Right.
For you. You mentioned feeling suicidal. Has that been every day? Has that feeling stayed with you throughout the 5 months?
It's almost every day. I try not to concentrate on it like, this is Thursday, am I going to think about it today? But I do find it almost every day that I think this just isn't worth it. This hurt, this pain, this.
Yeah. Have you thought of a particular way to hurt yourself, or have you thought of hurting yourself, or killing yourself?
When I drive, I think I'm going to drive off the side of the road. What I'm really worried about is that I'm afraid I wouldn't die, and that I would just be hurt, and that would be worse for my family.
I see. Do you have to fight off the impulse to turn your car off the road at times?
Yeah, sometimes. Not this week.
Great.
But I have in the past. I drove onto the shoulder of the road a couple of times and stopped, just crying, sobbing.
Right. Do you cry? I noticed that you were a little tearful a minute ago. Do you cry a lot at home?
All the time. All the time. It's almost uncontrollable. Yeah. I mean, I cry about stupid things.
How about your sleep? Is your sleep disturbed?
I've been having trouble with my sleep, I guess, for quite a while. I wake up in the middle of the night.
Do you ever wake up at 4 or 5 in the morning and you're unable to get back to sleep?
Absolutely.
How do you feel? What's in your mind when you wake up at 4 or 5 in the morning?
I'm really tired. I'm physically heavy.
How about your sex drive?
I don't have one anymore. Okay. But I'm not sexually active.
But that's gone.
Yeah.
Very diminished. Do these episodes of feeling depressed, do they come at a particular time of year?
I haven't been able to pinpoint that there's...
When you feel depressed, how does that affect your relationships with other people?
I have been systematically getting rid of my friends and my family, other than my children, one by one, over the past several years. I now will not answer my phone and will not answer my door. I figured out that I own the phone, and if I don't want to answer it, I don't have to. And I own my door in my house, and if I don't know that someone is coming, I don't answer the door.
What feeling prompts you to shut the door or not answer the phone?
I'm afraid. I'm scared to death that they're going to ask me to do something, and then I won't be able to say no. I have a hard time saying. I'm afraid somebody's going to say, you want to go to the movies? Do you want to go see a show? Do you want to go shopping?
Okay, and let's say they ask that. How would that make you feel if they asked you to go to the movies?
Like I had to do it.
And if you did it? You went to the movies?
I don't want to do it.
Is there anything you can get pleasure out of doing?
There isn't anything I want to do. I work sometimes and I'm okay once I get there, but the process of getting up and showering and getting dressed and leaving the house is just almost more than I can do.
Let's switch gears just a bit. Can you estimate the number of times you've felt depressed in your life since you've been a teenager?
Between 15 and 20, maybe.
Okay.
And I'm really just guessing, because if I could be more accurate about that if I sat down and remembered all the times, because I can remember sporadic things that, you know, I felt really, times when I felt really, really bad for a year or a year and a half.
Mm-hmm. Mm-hmm.
But I'm just kind of guessing.
That's okay. That's okay. In between those times, do you feel normal? Do you feel yourself?
I don't know exactly what normal is. I thought everybody felt like this all the time. Just in talking to other people, I thought everybody kind of felt suicidal at times. I thought that was a very real thing that everybody felt. I didn't know that some people never, ever think about that.
Are there times, between the times that you're depressed, when you don't feel guilty, you don't have a low energy, and you're not crying?
Yes.
Are there periods of time like that?
I've had some very productive times in my life where I worked real hard and felt real good about it, and felt good about my family and thought things were going to be okay. And
Barbara shows us many of the most characteristic symptoms of someone with a major depressive disorder. She describes a sense of hopelessness. She describes a lot of guilt. She talks about suicidal feelings and having to fight off the impulse to harm herself on occasion. Actually, when we asked her what depression means, she says lethargy. So she's got the low energy and retardation of depression. I think in many ways she's very classic for a patient with major depression.
In fact, I think one of the things that's important to distinguish is that she has major depression instead of dysthymia, although she has some of the features of someone who would have dysthymia, having had depressive symptoms for a very long time. She has so many symptoms of depression. She meets all the criteria for major depression. And she's also had clear-cut episodes where the depressive symptoms go away. She describes periods in her life where she really did function fine. She worked and felt much better during those times. So she's had some intermittent episodes where she functioned better, but really quite a lot of episodes and quite severe episodes where she functioned very poorly because of the depression.
Right, just to punctuate that, she doesn't have a single episode of major depressive disorder. She has what we call the recurrent subtype.
And also, I mean, in DSM-IV, we can have a diagnosis of major depression superimposed on dysthymia, what people in the past have called double depression. But the differentiating factor, I think, is the first 2 years of the dysthymic condition has to be without a circumscribed, demarcated period where the person met criteria for major depressive disorder.
I wonder if we could focus more now on how this depression is affecting her relationships with other people and her ability to function, and her role within the family.
She appears to have reversed roles with her children, expecting her children to take care of her instead of the other way around, and being quite angry with them when they didn't.
One of the things that she commented about was cutting people out of her life, and it sounded rather systematic. She may have even used that word, that she's progressively excluding people, and talked about coming to the realization that she owns the phone and she owns the door and she doesn't have to answer them. It sounds as though there really has been a progressive impairment in her social life.
when she talked about her depression, she also talked about once the children were out of college and her life was, well, she didn't say her life, but it was all done. I assumed that she was saying that everything was over. She had done everything. She had raised her children. She had taken care of them. And now it's time for her to die.
I think that's a good point. Something else about her particular statements that concern me is this phenomenon she describes of locking herself away and expecting other people to get her out of that bad situation. If she made a suicide attempt, she might well expect someone to find her and rescue her, or she might count on that and be disastrously mistaken and might die, in a sense, by mistake, thinking that somebody would find her and they wouldn't.
Well, at the very least, this cryptic comment about having, things being done alludes to certainly the feeling that her sense of purpose in life is now adrift. She talked about wanting to find a new sense of purpose to replace this one. But it certainly does sound like it would be a risky time for her in terms of risk of suicide.
Barbara is very typical as a sufferer of major depression, given the fact that she's a woman. I mean, major depression is about twice as more common in women than in men. And I think the thing that's striking is in the last 10 years or so, there's been a dramatic increase in the rates of depression in the U.S., or actually worldwide populations. Depending on how you define it, rates amongst women in some studies have been close to 40% of the population. So I think that
that's
this
a
is
lifetime
risk of depression. So I think that depressive problems and depressive concerns are certainly very common, that in the mental health profession you typically see people presenting with depressive symptoms and problems very commonly.
But I think part of that is just that it's recognized more now than it was previously, and also that there are more things we can do to treat depression, so that when there's a reason to identify someone as being depressed in hopes that they can get successful treatment.
I wonder if we could talk a minute about other possible coexisting problems that Barbara might have that we didn't have a chance to get through it entirely in this brief interview. For example, substance abuse, alcohol abuse. That's frequently a common accompanying problem of people with depression.
She would certainly be at risk for that, wouldn't she?
Other anxiety-related symptoms such as panic attacks or obsessive thoughts, while she might not meet the criteria for that additional illness, those other kinds of anxiety-related symptoms would be commonly present. I think the other issue we haven't touched on, we should touch on, is that we don't have a history, either within or outside the interview, for her ever having had a manic episode. So this is, if you will, a unipolar depression. That is, she's only had depressions. They're recurrent, but we don't have a history for either hypomanic or manic episodes.
What's really, comes home with this woman is that not only do we see that, very pronounced suicidal thoughts, but also the tremendous amount of guilt that she has, and an incredible amount of depressed feelings and disturbances in sleep and appetite. So, it really brings home to me how various signs and symptoms can kind of cluster together. And the diagnosis here is really a conglomeration of all those different symptoms.
One other comment to make is the difficulty of treating patients like Barbara. Usually we use a combination of drug treatments and psychotherapy, but it is difficult because it's hard to be with her hour after hour or week by week, day by day. That sadness comes across very strongly.
Although she was actually quite animated compared to many patients who have depression, and I thought that was one thing that was sort of unusual about this particular interview, is that she actually did quite easily express and allude to a lot of the symptoms that she'd had, and it wasn't so hard to get those symptoms from her. And I think there are a number of cases where you can sit with somebody and not get anything from them. You're sort of trying to elicit things that may the helpful.
Well,
she was really difficult.
She was also able to react to things I said, and sometimes lack of reactivity. The patient just doesn't react to any kind of encouragement or anything you say, is characteristic of melancholic depression, but she did have some reactivity, and that would be an asset in terms of treating.
Her discussion of anger, I mean, you see anger frequently in people with major depression, but usually it takes a long time for them to be able to get in touch with that and verbalize it. And she was right out there in terms of telling you how angry she was.
Her treatment might be complicated in a different way. That is that she was so eager to tell you about her symptoms. I almost got the impression that she was invested in making sure that you understood that really what she is a person who's experienced lifelong depressive symptoms, suicidal feelings, and that might be a little bit hard to give up.
Mary suffers from bipolar disorder, also called manic depressive illness. When we first interviewed her, she was in the depressed phase of her illness. And then, quite surprisingly, 3 days later, she switched into the manic phase. And so we have the opportunity to show you Mary in both phases of her illness. Please note that certain psychotic symptoms are present in both phases.
We could talk a little bit about the night you had last night. You really had a rough night.
Yes.
Yeah. How did it start? I mean, you mentioned a little bit to me when I came onto the floor this morning.
Well, I was having like a revelation, and the devil was saying something to me. Go get her. She tried to sleep with you. But again, I didn't want to hurt her. But I did.
Mm-hmm. And you mentioned voices this morning.
Yeah, I hear lots of voices.
Yeah. And they said something to you about her?
Yeah.
What did they say?
Go get her.
Go get her. They say anything else?
You had to kill the devil.
Okay. So you thought she was the devil?
Yeah.
Okay. Has that happened before?
Yeah.
You got a message like that somebody was evil.
Out to get me.
Yeah.
Yeah.
Why would they be trying to get you?
I don't know.
Have you put together any thoughts about that? I mean, is it because of something that you have or any special position you have in the world?
I feel like I'm on top of the world, looking down on creation, and the only explanation I can find is the love that I've found ever since you've been around is going to put me on the top of the world.
What's your relationship to Jesus Christ?
He's my Father.
Okay. I mean, a lot of people say Jesus Christ is their Father. Do you have a special relationship with Him right now?
Yes.
Can you say a little about that?
Just that
You got sidetracked there. Can you tell me what you were thinking, or were you hearing something?
no. I feel like I'm being judged all the time. And I've always said, judge lest ye be judged.
Uh-huh. Who's judging you?
People.
People. Does this situation feel tough to you because of that, feeling judged?
Yeah.
Like kind of like you're being observed or,
A little bit.
Okay. Let me know if it starts to feel uncomfortable because, of course, we're just doing this to do a training or a teaching thing. But if it starts to fit into some of those other feelings you've had before, it might start to feel uncomfortable. Just let me know if that starts to happen.
Okay.
Just then, were you hearing any voices?
No.
You seem to get distracted a little bit.
I think it's because I have a disease. of the brain.
Uh-huh.
There's something wrong with my brain.
What do you think it is?
I want to be a little kid again instead of a grown-up.
Mm-hmm.
Because everything was so calm and cool and collected when I was a little kid, except for when my dad was beating me up.
Yeah, well, that doesn't sound good.
Sometimes I think I'm possessed.
Who are you possessed by?
I don't know.
By someone or something good, or
Yeah.
someone or something evil?
Something, both.
Both.
Sometimes I can't detect which is which. And then I hit that one guy.
This was all part of the same thing last night?
No, this was...
Oh, a different time?
Uh-huh. I went into his room and punched him in the face. His name is Mark.
What was going on there?
I went outside and put my hands up in the air like this.
Mm-hmm.
And everybody was scared and cussing at me and what have you. And he was standing in the way where they couldn't see me. And he made me mad. And then I had this feeling I wanted to be with him. Sexually.
Mm-hmm.
And that made me sad and happy, a whole bunch of different feelings all at one time.
Mm-hmm.
Because I hadn't had that feeling with my husband in a long time, like I did when we first met.
Mm-hmm.
It's a conflict between my husband, too, and the world.
You know, in between these episodes that are happening now, I guess every year or every other year, that everything goes back to normal.
Yeah. When I don't take my medicine, though.
But when you don't take your medicine...
It happens again.
Okay. When you are taking your medicine, though, is there still this kind of active battle between good and evil going on?
Yeah.
Can you hear anybody's voice at those times? Do you hear voices?
Yeah.
When you're on your medicine?
No.
In between the flare-ups?
Yeah, in between the flare-ups.
You do hear voices?
Yeah.
But it stops when you're on your medicine?
Right.
Okay. And how long does it stay away for?
Till I stop taking my medicine.
So it could be months and months, or even a couple of years.
Well, see, like the first time I got sick was 85.
Uh-huh.
And it separated itself for 3 years. I figured 85 was the devil. He had me stinging from head to toe.
Mm-hmm.
I was so stoned. It wasn't funny. My husband jabbed me in the left shoulder blade like that, trying to get him off my back.
Mm-hmm.
And then I believe it was God who came again to me in 1988, which was separated from the devil for 3 years. And then he came again in 1990, in 1992, and now in 1993.
But in between those times, no devil. Okay. And what's your mood like in between those times?
On top of the world.
I mean, when you're taking your medicine,
Mm-hmm.
do you feel high or just normal?
Normal.
Just normal. Okay. How would you describe how you're feeling now?
A little scared. A little anxious. See, there's so many things. I believe God sits up there and smokes. I believe he sits up there and smokes pot. I believe he sits up there and smokes cigarettes. I even believe he snorts cocaine.
Were there periods where you've had weeks where you were sad? Not on top of the world.
Yeah.
Not like you are now.
Being fat and ugly. Didn't want to live anymore in this world.
When was the last time you went through a period like that?
This time.
This time?
Yeah.
Okay. Feeling like you didn't want to live anymore.
Yeah.
How long would those feelings last?
For a year.
For a year. When was that?
1992.
92. Can you think of a few weeks in there where it was really at its worst?
Yeah.
What did you do during those weeks?
Smoke dope.
Smoke dope. Did that get you through it?
Yeah.
Did you have to see a doctor or go into the hospital at all?
Eventually, yes.
Okay. You have a bandage on your hand. Can you say something about what happened?
My husband.
Mm-hmm.
I think he plays around on me.
What makes you think that?
Because of all the things I see.
Is that related to the bandage?
Yeah.
How is it related?
I burned my heart.
You burned your heart. You know, there were, last week when I saw you, there were 3 round circles there and there was no bandage.
Yeah.
How did you get the circles?
With the ashes.
From a cigarette?
Yeah.
Okay. And you were burning it kind of like you were burning your heart?
Yeah.
Because you were sad?
Because he walked away from me again.
Okay. Well, Mary, I'm glad you could come back. Can you say how you're feeling this morning?
Oh, on top of the world.
Okay.
Whoo, 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 on top of the world.
What are your plans for today?
Oh, it's just going to be one great day.
What are you going to do?
Well, go out, whatever my doctor says I can do, I should say that right now.
Tell me a little bit about that. You mean you may have some restrictions?
Yeah, still. I went off with my husband last night. I beat him up.
What? No, tell me about that.
I wanted him out of there.
He came to visit?
Yeah, he came to visit me.
Okay.
And he pissed me off, so I wanted him out of there, so I beat him up.
Now, what do you mean you beat him up?
I forcibly beat him up.
You hit him?
Quite a few times. Oh, yeah, slugging it out.
You were saying something earlier about Jesus Christ and the CIA.
Okay, I'm in incognito for the Lord, God Almighty, Jesus Christ. Okay, I'm working for him. I have been for years.
Now, what do you mean incognito?
I'm a spy.
And what's your mission?
My mission is to fight for the American way.
Can you say more about it?
The Statue of Liberty.
Okay. But I mean, can you talk more about the kinds of things that you have to do or have been doing as part of that mission?
Oh, I can bring up the wind. I can bring the rain. I can bring the sunshine. I can do lots of things through Christ who strengthens me.
Okay. I mean, you can actually cause the wind to come up?
Oh, yes.
Could you do that today if you wanted to?
Sure. Oh, yeah.
And what gives you the power to do that?
God.
On our walk down, you were mentioning about the air and the smells, and we saw some flowers. You like the outdoors?
I love the outdoors. It's my favorite place to be is outdoors.
Yeah.
Well, see, when I first met my husband, can I just talk?
Sure, please.
When I first met my husband, we lived underneath a bridge and down at a boat dock. We weren't married. But I believe we got married in the eyes of God down at this boat dock because he popped my cherry, and I had been married before.
When we first sat down, we asked if you could take your gum out, and you had some strong feelings about that.
I've chewed it since I was a little bitty kid. Don't hurt my teeth or nothing. I got strong teeth, and I like hard gum. I like to blow bubbles with it.
Okay. Is that a good piece?
Yeah, it's a real good piece.
Okay.
You want a piece?
No, thanks. So, talk a little bit more about the way that sometimes you start crying. I mean, what's the sort of thing that can get you crying?
Missing my mom, for one.
Okay.
She died. I told you that my mom died.
I think so.
April 5th, 1993. My mother passed away.
What happened?
Well, she hadn't walked for 21 years of my life. Am I still focused?
You are.
Okay. That sounded funny, didn't it? Am I still focused? Okay, anyway. Back to the seriousness. Okay. She had cancer of the spinal cord when I was 11 years old, and they had to take out her backbone, 8 inches of her backbone out to kill the cancerous tumor. So that means she was paralyzed from her breast down for 21 years of her life. She died the age of the year I was born, 61. I believe everything has a purpose under heaven.
Yeah, what do you make of that?
I believe that's the time that God wrote down she was going to die. Before she hit her 62nd birthday, she was going to die and be my guardian angel at 61 of the year I was born.
You mentioned the other day that drinking coffee, something happens to you.
I get drunk on it.
Let's say something about that.
I can get drunk on coffee. I can get drunk on water. I can get drunk on Kool-Aid. I can get drunk on lots of things.
Now, can you get drunk on those things at all times or only at certain times in your
When
life?
I'm high.
When you're having one of these up periods? Yeah. Are there times when being up like this is unpleasant?
It always feels good. Never feels unpleasant at all, except for when I can't go to sleep because of it. When I'm too up and I cannot sleep. That's the only bad part about it.
How did you sleep last night?
Worth a damn.
Not good.
No.
How many hours?
I didn't sleep at all. I just rested.
Even though you didn't sleep last night, you still have good energy?
Oh, yeah.
Do you feel as good as if you had gotten a full night's rest?
Oh, yeah. Big time.
Okay. Were you able this morning, feeling this good, were you able to concentrate on things that you wanted to concentrate on?
Sure was. I helped him put some stuff away.
Okay.
I folded laundry.
Okay.
I stocked socks together.
Okay. Do you think that if you were outside the hospital right now, you'd be able to do all the things that you needed to do?
Oh, yeah.
Sometimes when you're feeling this good, do you go out and do things that get you into some kind of trouble?
Oh, sure.
Like what?
Mess around on my husband.
Okay. And it gets you into trouble?
Big time.
Yeah. Okay.
And the voices, my gosh, can I hear the voices?
Talk about the voices.
It's what's around me, like up at the front desk. People outside my window, I can hear them all.
Now, are these voices of people that you can't see?
Right.
Okay. What kinds of things are they saying?
Well, that's none of my business, really.
Is there anything else that you want to mention?
Yes. I'm a morphodite.
Yes, talk about that. You mentioned that to me one time.
Okay. I'm a male and a female mixed.
Okay.
I have both organs. And I believe that that's the way God is up in heaven.
Okay. Mary, I want to thank you for coming back. So we've covered a lot of things.
Yeah.
Okay. Thanks again.
You're welcome.
Okay.
And cut.
Okay, John, you did a great interview with Mary. Could you go over the most characteristic symptoms for us?
Mary is a really engaging person to interview, and certainly we saw two different states in the two interviews that we watched and the two interviews that I did. The second interview really, I think, captured very well the state she was in, where her mood was elevated, she was expansive. We didn't see so much, but we heard about how irritable she was. I think she had gotten into a scuffle the night before. And the other features that were really prominent were her slightly pressured speech, her flight of ideas. She kept intruding into the flow of the conversation with a kind of non sequitur, something that didn't follow. She also had some distractibility. We saw her turn to the camera several times, and it was hard for her to focus. We also saw some prominent delusions and a psychotic element to her presentation, and I think that's another important part of what's going on with her. The first interview that we saw was quite different, and she was showing some motor retardation. Her mood was down. She talked about being sad. I think she talked about being anxious. And the interviews were only separated by a couple of days. So we really saw a rapid transition.
She's obviously switching back and forth fairly rapidly. But is she switching back and forth rapidly enough to meet the criteria for a mixed state?
Well, we really didn't see her go into a full-blown syndrome of mania or depression completely with a rapid time course.
Actually, DSM-IV draws the line at a single day, insofar as the evidence of both states have to be present in a single day. And from what we know about this patient, she doesn't quite meet that criterion. So I guess we would say that she's a rapid cycling patient, but has distinct phases, not
Yes.
a mixed. One of the most things that's most striking about Mary is the dramatic contrast between the two mood states. On the other hand, it's important to point out there were some features of her illness that remained present in both mood states.
That's
One,
true,
of
yeah.
course, was the psychotic symptoms, and the other was still some element of flight of ideas or silly behavior. For example, even in the depressed phase, she answered one of your questions with the lyrics from a Carpenter's song.
That's right.
Which you wouldn't think of as typical of depression. That particular behavior would be more classically manic.
When you see evidence like this of breaks with reality, psychotic symptoms, irrational beliefs or delusions, and perceptual disturbances or hallucinations, you have to think of other psychotic disorders that the person could have. The two major ones I would think would be schizophrenia, which is those marked psychotic disturbances, but without really that pronounced disturbance in emotion or mood, and schizoaffective disorder, where you see the occurrence of both mood and emotional disturbances with psychotic symptoms. What makes me think from her presentation it's more in the direction of the bipolar disorder is that it's from what we know about her history that we didn't get into in a lot of detail on film, is that her psychotic symptoms always co-occurred with her disturbance in mood. And we really didn't see a period when her mood got better, but she continued to have psychotic experiences. And actually, I think we see some elements of those psychotic experiences really during both of these states during which the two different interviews were done.
Right, if she had been a CIA agent and had told you about being a CIA agent and hadn't been making you laugh at the same time, and simply had those psychotic features, then you would think of other diagnoses. But the fact that she was engaging, blowing bubbles at the camera, telling jokes, being very open about sexual indiscretions in the presence of psychotic features, I think leads one much more clearly towards the diagnosis of bipolar disorder.
You know, the first interview where she was depressed, you know, I got the feeling that maybe she had been medicated, you know, because she looked so staunched, so really stiff.
That's a very good point, that certainly medication side effects can mimic the kind of slowness of movement that goes along with a depressed picture. And you've always got to consider that when you're trying to evaluate someone. I think Mary really did have a depressed state at that time, but I think there were medication side effects too.
Barbara, you've taken care of a lot of patients like this.
Oh, yes.
How dangerous are these patients when they're in the manic phase? And what do you typically do, or how do you interact with them to help reduce that?
This is a lady who is experiencing a mood disorder where she's high one minute, she's low the next. But there's no way for us to predict because she can't predict. So therefore someone should be, you know, you establish some type of relationship with her. You know, even though she's going to tell you there will be times she won't want you near her, but still have her where you can protect her from others and from herself. And personally, I love manics.
Well, I think, Barbara, that's a very interesting point that you touch upon, and people have asked me that frequently. Boy, if I could only have bipolar disorder and just have the mania, you know, wouldn't that be great? But the fact is, even when people have manias or predominantly as a part of their illness, we see, you know, an end state that's very, very unpleasant to the person. That, I mean, they get into fights, physical fights, and they do these, engage in these kind of behaviors that in the end are really quite destructive and can be very hurtful to the person. A lot of times people with bipolar disorder, and especially when they're manic, will stop taking their medication because that initial high feels good. But unfortunately, as is the case with this woman, it's so common that the end state progresses from a high period to just, you know, higher and higher, to the point that you can't sleep, you know, and you can't concentrate, and you can't focus, and you get involved in all these activities and behaviors that really are very, very, very painful.
I wonder if we could have interviewed the husband. That might have told a very different side of the story. Diane, what would it like to be the husband of Mary?
Well, it would be pretty difficult, I think. Often a person in a manic state will really exhaust their family because they're up all night, they're on the telephone all the time, they're expecting all kinds of things to happen that are impossible to happen. They often get in trouble with the law, and the person in this manic state doesn't have very much insight about what the effect that they're having on other people. They think that people are really enjoying the way they are, and everyone is having a good time.
Part of the time.
Part of the time, but it gets a little, a little intense and a little extreme, and then people start running away from them, and they think everyone else should be having as much fun as they're having, and they have no insight as to how demanding they are, how intrusive they are, and how irritating they become.
I think part of it is a lack of insight, and
Yes.
with Mary, part of it is the grandiosity.
Yes.
This belief that really the whole show or the whole party may well be for them.
Right.
And her grandiosity was of delusional proportions. She believed that she had a special relationship with God and was on a special mission.
But this lack of insight, not really having an understanding of what's happened and the consequences, is something that makes it very difficult to treat people with bipolar disorder. I remember one time I interviewed a woman who had been brought to the hospital after she had literally started a riot in a fast food chicken restaurant. And interviewing her and taking a history, you know, I'd asked her what had brought her to the hospital, and basically she said, well, I walked into Church's Fried Chicken, asked for a glass of water, and then the police came and brought me here. Which made me very nervous. Don't ever ask for a glass of water in Church's Fried Chicken, you'll end up in a mental hospital. In fact, that's not true. I mean, she kind of didn't have any sense that she had started to get loud and angry, and she was laughing and joking, and people weren't talking fast enough and moving fast enough for her, and before you know it, it got to the point. She frightened people.
Yeah.
Maybe one more comment to make is talk a little bit about whether certain groups of people are at higher or lower risk for this particular disorder, and as far as we know, like schizophrenia, which we'll see later in this series, bipolar disorder can affect any socioeconomic class, any race, men and women equally. Clark has a complicated sexual problem. He really has two complaints: a loss of interest and poor performance. You'll also see that the causes of his problem are probably many, both biological and psychological. Finally, be patient. It takes a while for Clark to begin to talk about his problem.
Thank you very much for coming and being with us here today. I appreciate your coming here and spending the time. Can you tell me what your main problem is at this point in time?
As it relates to depression and feeling, I think probably just a ongoing, what I call light case of depression. It seems that it never goes away. It seems that it's always around. At some level or another, the level changes some, but it's just fairly consistent. It may get worse when situations occur, maybe better, but it seems always to be present.
And how long has this mood that's not a full-blown depression, but a somewhat depressed feeling been with you?
Let's see, I remember first identifying depression situationally in 1977, and that's been several years now, hasn't it? And that was a situational condition in my family. I raised a very troubled family, and children got in trouble and bad trouble, and I began to identify depression as a response to that. And for about a year, I felt I was really depressed. Basically, always looking at it as a situational kind of thing. Then, how do I say it? Part of that never went away.
What symptoms did you have in '77?
I think basically the feelings that I had. It was of not wanting to go to work, wanting to stay in the house and not leave.
And did it include disturbance in sleep, appetite, energy level, concentration?
Energy level, concentration, definitely. And you know I'm clergy, and which is a very public profession, and the people said they could hear it in the presentations I made, the Sunday services, the sermons, that kind of thing. When I felt I was, I really wasn't expressing it. They felt that they could hear it. Energy level was low.
During the time you were depressed, were there changes in sexual functioning?
During that time, I don't remember a whole lot. Eventually, there was change in sexual function, but most of that's been within the last 5 years. There's been some sexual slowdown that really, you know, I don't know how much I can attribute that to depression. Part of it I have to attribute to physical, serious prostate infection, some of those things, and but I don't know how much I attribute that to emotional condition.
How long have you had prostate infections?
It started in 1980. I remember because I was changing jobs at that time, and it was lower back pain, and I thought it was a back and bone problem, and it must have been 6 months, and we worried about that, and then I discovered that it was a prostate infection, which became chronic.
Any circulation problems at all? Chest pains, pains in your legs when you walk?
Yes, I have an arthritic condition. The lower back, both knees are the worst place, and there has been for a number of years circulations, poor circulation in my legs.
What kinds of sexual problems have you had in the last 5 years?
I think I'm simply just as not as my sexual drive has just declined.
So it's a change in the level of desire, or
Yes.
is it also a change in the ability to maintain an erection? Or?
Has been both. I think probably the change in the ability to maintain an erection was worse when the prostate infection was bad. But I can't attribute all of it to that. The change in desire, or the change in arousal cannot be totally attributed to that.
And any other things that go along with that, such as change in dreams, or not waking up with an erection, or any other kind of general indicator of?
Yes, it is not as common for me to wake up with an erection as it used to be some years ago. And I don't know, people argue about, you know, what happens to a 60-year-old person, and I really don't know. I think probably the biggest crisis was with both the low-grade depression and the enlarged prostate, which was causing malfunction, and that was a couple of years ago. Maybe a year ago. I don't know just exactly how long ago.
Have you had pain with intercourse, you know, with part of the infections? Has that been a component, or has that not been
Yes,
involved?
it was for a while.
But not currently?
And burning, tremendous burning.
And has that had an effect on the sexual functioning, or has there still been an ongoing
the sexual
problem.
functioning is better. I don't have the pain. I don't have as a serious a problem of maintaining the erection, and there was a what do you call it, premature ejaculation. I just simply couldn't understand. In the process of becoming aroused, all of a sudden it would be over, and I didn't understand that at all. So then everything is coupled with a bunch of depressing thoughts, like the fear of failure. And so I began to say, is this happening to me because I'm afraid I'm going to fail, and I don't want to be embarrassed by that? And it's really very difficult emotionally to deal with.
But that has stopped. The premature ejaculation has stopped.
Yes.
And the pain has stopped.
The pain has stopped.
And what the main problem now is less arousal.
Right.
And some difficulty maintaining an erection. Is that
Some, yes, I think some. There have been some times lately when I've had difficulty.
Does that seem to change at all with depression? Is there a connection between a phase, say, when you're a little more depressed and having more sexual difficulty, or do they seem to be unrelated?
I haven't really thought about the connection, regularly. I'm sure it has some effect, and I don't know. It has to have some connection, because when I'm depressed, I don't. My spirit is not good. My feeling about myself. I shouldn't be this way. I'm a intelligent, capable, professional person, and I shouldn't be having this problem. And the worse I feel about myself, the slower I am sexually. And sometimes I describe it as the fear of losing masculinity, which is a tremendous fear with me. And depression has to have something to do with it. It has to be a contributing factor somehow. How much, I don't know. How much of it is physical, how much of it is emotional, how much to attribute to this, that, or something else.
Right. Certainly there seem to be a number of different factors, possibly some circulatory involvement. Now that the prostate is cleared up, you can see clearly that was involved as well. Depression seems to be involved to some extent.
Sometimes I think some of the medications I've taken have affected me sexually as well. And it seems to me there was at least one antidepressant that I felt really affected it.
Do you think you had started to say something, I think before I interrupted you, about how you were worried about masculinity. Is that connected with depression? Is that thought connected with depression, do you think?
I mean, yes, in some ways, I think. I think of, how do I just put it? A real man oughtn't to feel this way. Ought to have more strength. I don't want to be weak.
Pull yourself by your
That's right.
straps.
And maybe that goes back to many of the much of the stuff that was put in my head as I was growing up about what a man is in our culture and what a man does and how a man functions and so on. Man doesn't cry, for instance, and I find myself crying, which pushes me deeper into the whole thing and frustrates me highly. And there has to be something about it has affected my concept of who I am, and particularly around the strength. I'm a weakling, you know, and that's it's kind of hard thought to live with.
How about your relationship with your wife?
I think, you know, if we're going to talk about sexual dysfunction and how that affects me emotionally, we need to say something about Julia. She is a gorgeous 42-year-old woman. And when I find myself not being able to function sexually, that has some effect. you see, of who she is and how I ought to be around her. And that causes me to say, hey, you know, yeah, you're not much of a man.
And so the two intersect in the sense of feeling diminished, that the
Yes.
depression diminishes you, and any kind of sexual difficulty diminishes you.
Also it contributes to it, and it has really changed my attitude and my ability to deal with things, and I've really struggled with that whole thing, and still am.
Clark has a complicated sexual problem, as we learned from that interview. Yvette, would you help us understand exactly what the components are?
I think he illustrates how difficult it is to make one single diagnosis oftentimes. I would say he has male erectile disorder due to a general medical condition, or actually in his case due to two medical conditions, because we heard that he had both recurrent prostate infections as well as vasculitis. In addition, he has inhibited desire, which was probably influenced somewhat by medical conditions as well as by his chronic dysthymia and his recurrent depression. He speculated about the effect of age, and although some people would debate that point, I think in general there's no reason to feel that as people get older they would necessarily have any falling off of desire or performance, unless there are other factors involved as well. What he talked a lot about was all his life having felt somewhat depressed, and then more recently having major depression, which had been treated, and feeling diminished by that, feeling like he was less of a man. He also talked somewhat about how that had been a factor in his relationship with his wife, how when he then couldn't perform, it made him feel quite depressed.
I was struck by the fact that several minutes really went by in the interview before we really came to the discussion of his sexual dysfunction. In other words, he didn't just kind of walk in and the first thing he said was,
"Hey, I've got a sexual problem." Right. No. In fact, I had been treating him previously, and during the course of the therapy, it took a while for him to feel comfortable enough to say that he had problems with sexual functioning. And I think that's quite typical in people who have problems with a variety of sexual disorders, that it may take specifically asking, do you have a problem in sexual functioning, before they're going to say, yes, they do, and wouldn't expect them necessarily to volunteer that information.
I wondered if that was, if something was related to him, if this being a male speaking to a female doctor.
Mm-hmm. I think certainly you could wonder whether my being a woman, his being a man, made it more difficult for him to discuss sex. I think sex is a topic that's difficult, whether it's man to woman, woman to man, man to man, or woman to woman. but I think it may have been more difficult for him to discuss that. On the other hand, since he had such an issue with performance, with being enough of a man, I would speculate that it might have been even more difficult to admit to a man that he wasn't man enough, if you will.
Okay.
Well, I think all of these are good points, and it's probably just tough to generalize about what any individual's response would be. As you mentioned, Yvette, it's just going to be a difficult subject to talk about in general, and it's going to come down to the rapport that the interviewer is able to establish with any given person. And I think, again, specifically asking.
Mm-hmm.
Right.
I think,
I was just going to say, it just the fact that he had other psychiatric conditions and physical problems just makes you think, you really have to ask and inquire. And I mean, there are many patients that many people that we may see with other problems, other conditions, and they may be having sexual dysfunction, and you know, it might not be the first thing they're going to say.
I wonder if we could take a moment to focus on, he wanted to focus on how this affected his relationship with his wife, and what if we could together consider whether or not treatment for this man might involve getting the wife involved in the treatment or doing couples counseling. What do people think about that?
That was what I was thinking. I think he would be a very good candidate for psychotherapy and family counseling or marriage couples counseling. And I was wondering if some of his rigid moral, sort of moralistic ideas had a lot to do with a kind of a cultural thing, even the way people were brought up to think about masculinity.
I had the opportunity actually to do couples therapy with the two of them, and that was quite helpful to give her an opportunity to vent some of the frustration that she felt, some of the fears that maybe she wasn't attractive enough, which is interesting because he always makes a point of saying how beautiful she is, but still the feeling remained that she was perhaps not attractive enough to him.
Yeah.
One of the factors that would be considered in this situation would also, of course, be the effect of different medications.
Right.
And as John mentioned, with increasing age, there's an increasing chance that people will have various medical conditions. There's also an increasing chance that they will be on an ever-increasing number of medications.
Well, one thing that he made very clear in the interview was that when the prostate infections were treated, he functioned much better sexually. But he's still, at this point, left with a kind of chronic dysthymia, which then, as he points out, very much influences his relationship with his wife.
I'd like to just emphasize that he has some substantial assets. We focused a lot on his problems, but he seems to be a very thoughtful person who has developed a substantial insight and understanding into this complicated problem that he has. What makes his case so interesting but so difficult to tackle is the multi-layered aspects of it. That we have multiple and interacting medical problems. They have acute Axis 1 type psychiatric problems insofar as the patient had major depressive disorder. We have psychological factors, including the interplay with his wife. And we have long-standing attitudes that probably also come into play.